That feeling, right there in the back of your throat. That thick, sticky something that won't budge no matter how many times you clear your throat. You cough, you hack, you excuse yourself at the dinner table. You wake up at 2 in the morning trying to cough it loose, and it just comes back. Maybe you've had it for weeks, maybe months. Maybe you've had it so long you've started to think, this is just what getting older feels like. I want to stop you right there, because that thought, this is just part of aging, may be the very thing that's keeping you stuck. What I'm about to share with you today completely changed how I think about chronic mucus and throat phlegm in my patients over 60. And I have to be honest with you, what's actually causing this in most seniors has almost nothing to do with what the average person assumes. It's not a cold, it's not allergies, and it is not simply getting older. Stay with me through this entire video because by the end, you're going to understand what is actually happening inside your body, and you'll have a clear, practical path forward that you can start on today. My name is Dr. Albert, and I've been practicing medicine for 30 years. Over the course of my career, I've treated thousands of patients, many of them seniors just like you, who came to me frustrated, exhausted, and embarrassed by this exact problem. Constant throat clearing, endless coughing, that maddening sense of something stuck that never quite goes away. And what I've learned over 3 decades is this: when you treat the symptom, you get temporary relief. When you find the root cause, you get your life back. That is what we're doing today. Let me paint you a picture I see all the time in my practice. A patient, let's say she's 67 years old, retired school teacher, sharp as a tack, comes in and says, "Dr. Albert, I have had this phlegm in my throat for almost a year. I've tried everything. Antihistamines, cough drops, even a round of antibiotics my other doctor prescribed. Nothing works." Sound familiar? Here's what most people don't realize. Chronic mucus in the throat, that sticky, persistent phlegm that won't go away, is almost never caused by a simple infection. According to research published in Pulmonary and Gastroenterology Medicine, the majority of chronic throat mucus cases in adults over 60 have a digestive origin, not a respiratory one. Let me say that again. The problem feels like it's in your throat, but the cause is often coming from much lower, from your gut. And until you address what's happening down there, no amount of throat lozenges, antihistamines, or nasal sprays is going to give you lasting relief. After age 60, your body changes in ways that directly affect how your digestive system works. Stomach acid production naturally declines with age. Digestive enzymes become less efficient. And a chain of events begins inside your body that most people, and even some doctors, never fully connect to that maddening phlegm in your throat. Let me explain what's happening inside your body, and I want you to picture this clearly. Think of your esophagus, the tube that connects your mouth to your stomach, as a two-way hallway with a security door at the bottom. That door is called the lower esophageal sphincter. Its job is very simple. Let food and liquid travel down into the stomach, then lock shut so nothing comes back up. Now, for that door to lock properly, it needs a signal, and that signal comes from the acid inside your stomach. When stomach acid is strong and concentrated, sitting at the right pH, the door gets the message and seals tight. Everything stays where it belongs. But here is what happens as we age. Stomach acid production begins to decline. The door doesn't get a clear signal anymore, and instead of sealing shut, it starts to drift open. When that happens, what's inside your stomach, acid, digestive fluid, sometimes bile, begins to creep upward. Not just into the lower esophagus, where it causes the classic heartburn feeling. In many seniors, it travels all the way up, past the esophagus, past the voice box, right to the back of the throat. This condition is called laryngopharyngeal reflux, or LPR, and unlike regular acid reflux, it often comes with no heartburn at all. Instead, the signature symptom is exactly what you're experiencing: chronic mucus, throat clearing, a feeling like something is always stuck, sometimes hoarseness or a scratchy voice. Your body is not producing that mucus to annoy you, it is trying to protect you. Your throat's delicate lining is being touched by stomach acid it was never designed to handle, and your body is producing mucus as a shield, a defense mechanism to protect the tissue from damage. The problem is that protection never turns off because the irritation never stops. And here is the part that almost no one talks about. Many seniors are prescribed antacids or acid-reducing medications for this problem. And while those medications can offer short-term relief, they do something counterproductive over time. They reduce stomach acid even further, which means the signaling problem gets worse. The door stays open longer, and the reflux continues, sometimes even intensifies, while the medication masks the sensation. It becomes a cycle, and many seniors have been living inside that cycle for years without realizing it. So what are the actual signs that this is what's driving your chronic mucus? And what is really going on in your body? Let me walk you through this carefully because I want you to leave today with clarity. The first thing to understand is the difference between mucus that comes from your airways and mucus that comes from reflux irritation. If your phlegm is worse in the morning, especially right after waking up or after lying down, that is a significant clue. When you're horizontal at night, that improperly sealed valve I described allows stomach contents to travel upward far more easily. Many of my patients describe waking up coughing, needing to clear their throat for 20 or 30 minutes before they can feel comfortable. That pattern, worse lying down, worse in the morning, points strongly toward a reflux origin. The next sign that surprises many people is the absence of heartburn. Most seniors assume that if they had acid reflux, they would feel that classic burning in their chest. But LPR, the kind that reaches all the way to the throat, often produces no chest burning whatsoever. Instead, you get the mucus, the chronic throat clearing, a voice that sounds rough or gravelly before noon. Sometimes a sensation like there's a small stone or lump sitting right at the base of your throat. If you've been checked for throat problems and everything came back normal, this is very likely why. Another pattern I see frequently is difficulty swallowing. Not a severe blockage, but a subtle sense that food or liquid doesn't go down as smoothly as it once did. Sometimes patients describe needing to swallow twice. That is the inflamed, mucus-coated throat struggling to function normally under constant low-grade acid irritation. Now, this one surprises almost everyone I tell it to. Many people with this kind of reflux actually have too little stomach acid, not too much. I know that feels backwards. If acid is coming up and burning my throat, how can I have too little acid? But the answer goes back to that security door. The door doesn't close based on how much acid there is. It closes based on whether the acid is strong enough to trigger the closing signal. When the acid is dilute or weak, the signal never fires properly and the door stays open. A small amount of even weakly acidic fluid then drifts upward and causes enormous irritation in the sensitive tissues of the throat and voice box. If you drink coffee first thing in the morning, eat grains heavily at every meal, or follow a diet high in processed foods and refined carbohydrates, you are very likely feeding inflammation in the gut that weakens digestion further and makes this entire cycle worse. If what I'm sharing today is helping you see your health in a new way, I want to ask you right now, please subscribe to this channel. For 30 years, I've dedicated my life to helping people understand their bodies, not just treat their symptoms. This channel is my way of continuing that work for seniors across America who deserve clear, honest health information. Subscribe, and I'll make sure you never miss a video that could genuinely change how you feel. I want to tell you about a patient I'll call Harold. Harold was 71 years old when he first came to see me. He was a retired contractor, strong, independent man, the kind who never complained. But his daughter had finally convinced him to come in because she was worried. He'd been clearing his throat constantly for almost 2 years. He'd stopped going to church because he was embarrassed by the noise. He'd stopped eating dinner with his grandchildren because he'd cough and they'd get frightened. He told me straight-faced, "Dr. Albert, I just figured this was the body wearing out. I'm 71. What do you expect?" I expected a lot more than this for Harold. When I asked about his symptoms carefully, the picture became clear. His mucus was worst in the mornings. He slept on his back, slightly reclined, and he'd wake up at night feeling like something was crawling up his throat. He had no heartburn, not once. He'd been on an over-the-counter antacid for about 8 months and felt like it helped a little, but never completely. We ran some tests. We had a conversation about his diet: lots of bread, pasta, cereal in the morning, very little animal protein, almost no healthy fat. His digestion had been sluggish for years. Harold had LPR. His stomach acid had declined with age, his valve wasn't sealing, and the antacid he'd been taking was suppressing what little acid remained, making the sealing problem worse while temporarily numbing the sensation. We made changes. We adjusted his diet significantly. We gave his digestive system targeted support to strengthen acid production properly, under medical supervision, carefully, with monitoring. We elevated the head of his bed slightly. We talked about eating windows and giving his gut time to rest overnight. 6 weeks later, Harold came back. He told me he'd gone back to Sunday service that week for the first time in 18 months. And he'd had dinner at the table with all 4 of his grandkids, without coughing once. He didn't tear up. Harold wasn't that kind of man. But he looked me in the eye and said, "I didn't realize how much I'd given up." You shouldn't have to give anything up, not at 71, not at any age. So what can you do starting right now? The first and most important step is to speak with your doctor about the possibility that your chronic mucus is being driven by silent reflux, laryngopharyngeal reflux, rather than an upper respiratory issue. Ask specifically about LPR. Ask whether your stomach acid production has been considered. This conversation alone can redirect your care in a meaningful way. The second thing is to examine what happens when you lie down. If your mucus, coughing, or throat clearing is worse at night or first thing in the morning, that positional pattern is a crucial piece of clinical information. Share it with your doctor. And in the meantime, try elevating the head of your bed by 4 to 6 inches, not just adding pillows, which can bend the body in ways that actually increase reflux pressure, but elevating the actual bed frame or using a proper wedge pillow under the mattress. Third, look honestly at your diet. Grains, processed foods, sugary snacks, and excessive caffeine all promote gut inflammation and can weaken the digestive signaling that keeps your esophageal valve closed. I am not asking you to make dramatic changes overnight. I am asking you to notice whether your symptoms improve when you eat lighter, cleaner meals, lean proteins, cooked vegetables, healthy fats, and whether they worsen after heavy grain-based or processed meals. Fourth, do not eat within 2 to 3 hours of lying down for the night. This single habit change has helped more of my senior patients than almost any supplement or medication I could name. When you go horizontal with a full stomach, you are inviting reflux. Give your body time to move food downward before sleep. And fifth, if you are currently on long-term antacids or acid-reducing medications, please do not stop them abruptly on your own. But do have a conversation with your doctor about the long-term plan. Ask about the effects of prolonged acid suppression on mineral absorption, particularly calcium, magnesium, and B12, all of which are critical for seniors. Ask whether there is an underlying cause being addressed or whether the medication is only managing the symptom. That question alone may open an important door. Here is what I want you to take away from today. That mucus in your throat is not a life sentence. It is not simply what aging feels like. It is your body sending you a signal, a clear, persistent signal that something deeper needs attention. And you deserve to have that signal heard. I have watched seniors in my practice reclaim their comfort, their confidence, their voice, their sleep, and their ability to sit at a dinner table without embarrassment, simply because someone finally looked deeper than the symptom and asked the right questions. I want that for you. I want you to sleep through the night without waking up to cough. I want you to speak clearly and confidently. I want you to enjoy a meal with your family without dreading what happens afterward. That is not too much to ask. That is what good health looks like at 60, at 70, at 80, and beyond. Now I want to hear from you. In the comments below, tell me, how long have you been dealing with this? Has anyone ever mentioned the connection between your gut and your throat mucus before today? Your answer might help someone else watching this video who is still too embarrassed to speak up. And if this video helped you see your health differently, please share it. Send it to a friend, a sibling, a spouse, a neighbor. Someone in your life is dealing with this quietly right now and does not know where to turn. You sharing this video could genuinely be the moment that changes things for them. Subscribe to this channel if you haven't already. Next time, we're going to talk about something that affects millions of seniors over 65 and is almost never diagnosed in time. And it starts with a symptom most people wave off as stress. You will not want to miss it.